Let's start with what the aorta is. That's super, super important that we all have a clear understanding. All of this information that's medically provided to you from us is written and created by our two medical students, Samantha Cullen and Adam Ahmed, as well as he was a medical student, but he's now a resident at Cedars-Sinai, Duke. I believe I'm pronouncing it Gow. I believe I'm pronouncing his last name correctly. I probably should have asked him that over the last year or two. It just then came up in conversation. All right. Thank you so much for joining us for a day about the aorta. It is Aortic Disease Awareness Month. This particular post is from Adam. He's a fourth-year medical student and kind of helping us out with these posts. So we're going to go over the aortic anatomy. If you've not done so already, please download your free copy of Aortic Dissection, the Patient Guide. It's free for you to download. It's free for you to sign up to receive a hard copy, and it costs you nothing or your physicians nothing to talk with them about ordering a bulk amount of 25 books per box, so that they can then pass these books out to their patients and the caregivers. And while that's for dissections, we do have our second guide. It will be coming out in 2025 early, called Aortic Disease, the Patient Guide. Let's keep going. Sorry, I digress. Let's look. Here we go. The aorta. This is your aorta. It is like the largest vessel, taking all of your oxygenated rich blood to everywhere. That's the easiest way to say it. It's going everywhere. So if we take a look at this candy cane shaped organ, which is what it is now, even though we all knew it to be a vessel, we start off with what's coming out of the heart and going up. That is your ascending aorta. It curves around and has three main branches that provide blood to the arms and to the head, and that would be your aortic arch. As it works its way down, it is now descending. That is your descending thoracic aorta, and that's thoracic because it's in the chest. There is a part where it's called the suprarenal abdominal aorta. It's right about after the diaphragm, and now you're into the infrarenal, which is after the renal arteries, which provide blood flow to your kidneys. And then it goes into the iliacs, which provide blood flow to your legs. And all of this is giving blood flow through other little arteries to your abdominal organs, your pancreas, your liver, your spleen, your intestines, the whole entire 9 yards. So it's the largest artery in our body, and it's an integral component of our cardiovascular system. Its function is to take blood that has been oxygenated by our lungs and to deliver it throughout the entire body. It's just this amazing thing, right? It helps perfuse every single organ, including your brains, your abdominal organs, your kidneys, and all these other tissues. The aorta is very resilient. It's a resilient but flexible vessel, and it has elastic, smooth walls that allow it to widen and to contract as blood travels through it in different volume loads. It has three major sections, like we talked about: the ascending, which begins at the level of the aortic valve. It has the aortic arch, which when it takes that cane-like turn and starts to curve, and it has the descending aorta, which that's when it starts to travel down through your chest and your abdomen to reach the lower half of your body. Keep these divisions in the back of your head, because we're going to refer back to it as we start to discuss some of the different disease elements that can occur throughout the entire aorta. Let's talk about the layers of the aorta. To the naked eye, it looks like it's just one tube, right? It's just a tube. But when you look at it cross-section, there's actually three main layers to the aorta. You have the innermost layer, which is called the intima, innermost. You have the middle layer, which is the media, and then you have the outer layer, which is the adventitia. So three layers, but when it's wet, it's kind of like working with wet tissue paper. Okay, so these three thin little layers make up this vessel, which if you saw it in your chest, it's actually quite large. It's startlingly large compared to what you look at when you see your veins and stuff in your arms. It's very large. The different layers of the wall. So the tunica, and that was through a cross section, intima, the innermost layer where the blood passes through, it contains special endothelial cells, which can actually help move the nutrients in the blood. Think intima, think innermost, okay? When people get intimate, they're very close, innermost, okay? See what I did there? All right, tunica media. So this is the middle or smooth layer, the smooth muscle layer, which has elastin and it has collagen, and it has it basically helps in providing strength to the aorta and the flexibility. So think media or middle, okay? Then you have the tunica adventitia, and I could possibly be butchering words. That's the fun of me reading what somebody else writes. So that's the outermost layer of the aorta, and it actually helps anchor the aorta to its surrounding structure. It is where the most of the strength comes from. Most of the structural strength of the aorta comes from the outer layer or the adventitia. Knowing these layers are going to be very helpful when it comes to discussing some disease elements that can affect the aorta, such as aortic dissections and aortic aneurysms. Let's also talk about the aortic valve. It's a very important thing to consider when you're discussing the aorta, would be the aortic valve. And this is what a normal valve looks like. This is what it looks like when it's closed, a cross section of the aortic valve. It's got 3 little flaps here. Those are called leaflets. You're supposed to have 3. You're supposed to be born with 3. Doesn't mean everybody is, and that's where we start to have some issues, okay? This is what it looks like when it's actually open. So it kind of does this, yes, and it makes that sound effect. Sound. Opens and then closes. Opens, closes, okay? The valve is actually responsible for the opening and closing as the heart pumps and helps prevent leakage, helps prevent the blood from leaking back into the heart, otherwise known as regurgitation. So you might hear your doctor describe the aorta as having a tri-leaflet valve, which actually refers to the 3 flaps of that valve that open and close when the heart beats. Do be mindful, however, some people are actually born with only 1 leaflet. That would be an uno leaflet, I think that's what it's called. And a lot of people are born with 2 leaflets, and that is called bicuspid. 2. That's where we hear the terminology of bicuspid aortic valve disease, okay? And most rarely, people can be born with 4 leaflets. I can't even picture how that's positioned, but that's a quadricusp. Having 4 leaflets is a quadricusp aortic valve, which often requires monitoring. Either of those, any of those will require monitoring and correction at some point to kind of help the heart function normally. Those are things that you are born with. That would be considered a congenital heart defect. It's not something that you get as you age. You're either born with a normal heart valve or you're born with something that's a lot more interesting, okay? It's not something that happens over time. You can't do something to yourself to create this. But the 2 most common diseases that can impact the aortic valve would include aortic stenosis. So stenosis means that it becomes tight and it makes it hard for blood to leave the heart because it starts to become rigid and can have, I believe it can have like stuff on the inside, so it just kind of compresses it in the inside and makes it smaller, the area space for blood to travel. Okay, so that kind of makes it a little bit difficult. Or, as I mentioned before, aortic regurgitation. And so that's when the valve becomes too leaky, and some of that blood will actually leak back into the heart with every single pump, which adds strain to the heart. And that's when the leaflets just don't come together to close it. There's a gap. They get a little flappy in there. And so you don't want that to happen. So that was all I wanted to bring up from the first one. There's a lot of links in here that you can look at, but it gives you a good sense of the overall anatomy of the aorta and of the valve. Okay, that's a great way to start off Aortic Disease Awareness Month. Any questions? No, kidding.